Central? Join the conversation online and be a part of WCTC's real-time talk. Like 1450 WCTC on Facebook and follow us on Twitter at 1450 WCTC. Jersey Central with Bert Barron.
Think we could listen to the radio or something?
On the new Talk Radio 1450 WCTC.
7:08, it's hour number 2 of Jersey Central on this Friday morning on the new Talk Radio 1450 WCTC. The voice of Central Jersey. I'm Bert Barron. Good morning to you. Our contest is coming up a little bit later on here in this 7 o'clock hour. Chance to win a family 4-pack of tickets to Von Thun Farms in South Brunswick. Always great family fun happening there. Before I bring my next guest up on the Jersey Central Newsmaker hotline, a rather important school closing notification to pass along to you this morning. We're doing our first school closing. It has nothing to do with snow, right? There was a closure today of one of the largest high schools in the entire state of New Jersey. And this is after apparently a fire broke out last night in the auditorium of this high school. So today, Hunterdon Central Regional High School is closed, and this is after a fire broke out in the auditorium. No one was injured. The fire was quickly contained. And what makes this particular high school one of the biggest ones in the state, 3,000 students from 5 surrounding towns that all attend Hunterdon Central High School, home of the Red Devils, right? But day off today for the students from Hunterdon Central Regional High School as a result of this fire last night. All right, let's get to the Jersey Central Newsmaker hotline. As you know, October is Breast Cancer Awareness Month, and here to join me to talk about some things involving routine care and some other very important information, I want to welcome back Dr. Edward Soffen, radiation oncologist with ProCure Proton Therapy Cancer Treatment Center in Somerset, New Jersey. Dr. Soffen, good morning. Welcome back to WCTC. How are you?
Good morning. Thank you. I'm great, and it's great to be back. Thanks for inviting me.
When I use the term routine care, I guess there's a saying in the medical field, or maybe outside of that too, that they say anything that's routine is usually a procedure that's done on someone else. But what can you share with us this morning, Dr. Soffen, about routine care and what the current protocol is involving routine care?
Yes. Well, routine care for breast cancer awareness, particularly this month, is women have to realize the importance of self-breast examination and regular mammography. Mammography or imaging of the breast with x-rays has been shown incontrovertibly to pick up breast cancers at an earlier stage. And when they're picked up early, they are extremely curable. And so this is one of the types of cancers where regular screening and early detection really can mean the difference between success and failure. So I encourage women to know their breasts, to be aware of any changes, and to get regular mammography. Now, the American Cancer Society recommends that women 50 years or older consider mammography every 1 to 2 years. But we can move that to an earlier date if there's a family history of breast cancer. In other words, one of the risks for developing breast cancer is a family history, and there's certain genetic markers that can also predict for it. So if there is a first or second degree relative in a woman's family, she might want to consider having mammography earlier, perhaps starting at the age of 40.
In terms of incidences of what you've seen, Dr. Soffen, in terms of whether it's younger women or older women, are you seeing a rise? Are you seeing maybe the early detection is paying dividends for some women? What are some trends that you're seeing at ProCure?
Yeah, well, absolutely. Women who are older are more likely to develop breast cancer, but we're seeing more women in, their early 40s and 50s who have breast cancer. And part of the reason is the mammography and the screening. Now there's this 3D tomosynthesis, three-dimensional mammography, which dramatically improves the sensitivity of breast cancer detection. This has been picking up earlier cancers in younger women. So it offers us an opportunity to cure women at an earlier stage rather than diagnosing them 2, 3, 5 years down the line when it's more advanced and they need more treatment.
Now, in terms of the proton therapy that's offered at ProCure, particularly has numerous benefits when it comes specifically, and I never knew that there was a difference, but I guess if you think about it, it makes all the sense in the world, for the left side of a woman's or a man's body. Why the left side of the body deserves some sort of special attention. Can you elaborate on that?
Yeah, absolutely. Well, let me go back 1 second and say that now most women can be treated with breast preservation. They don't need to have their breast removed, which is called a mastectomy. Most women can have the tumor removed, called a lumpectomy, and then we treat their breast with radiation. Now, with conventional radiation, the X-rays go in one side, they go out the other, and we are concerned that the heart, which is obviously under the left breast, can get some scattered dose of radiation. When we treat with protons, which are particles, unlike X-rays, they go into the breast and they stop. And so we can treat the breast without getting any scatter radiation dose to the heart. So we do believe that women who have left-sided breast cancer may have an advantage to getting protons because the dose to the heart is 0, as opposed to a minor dose that they may get with conventional radiation. And that may actually mean the difference not 1 year or 2 years down the line, but 5 or 10 years down the line when women are postmenopausal and can develop coronary artery disease. So we think that protons really may have an advantage for women who have left-sided breast cancer because of the heart that's right underneath the left breast.
And it makes all the sense in the world that even, and maybe this is true, you're obviously closer to this than I am, but in terms of our lungs, isn't one of our lungs actually smaller than the other one just to accommodate space for the heart? Is that true?
Yes, that is true. The
Wow.
left side, the left lung has 2 lobes, and the right lung has 3 lobes because we need the space on the left side for the heart. So yes, we do worry also about underlying lung damage from the radiation, and that also is a concern. But women who have right-sided breast cancer, we also are concerned about the lung underneath it.
Gotcha. Very important. Dr. Edward Soffen is with us here with radiation oncologist with ProCure, Proton Therapy Cancer Treatment Centers. With October being Breast Cancer Awareness Month, and Doctor, your timing is impeccable. Today also happens to be National Mammography Day, where that's getting discussed a lot today, which is good. You, of course, can get more information about ProCure at their website, ProCure.com. What can a patient expect, Dr. Soffen, when they go to ProCure for treatment? Walk me through a typical day, if there is such a thing, at ProCure.
Well, there's no typical day, but what we try to do is make each day typical for them. They'll come in. First, they need to meet with one of our physicians to consult. Then we'll do a planning session where we map out where the radiation is going to go. We do all the calculations, and about a week or so later, we'll bring them back. They'll come in for their treatment on a daily basis. They are immobilized on a table. We align the beams perfectly, and then they feel absolutely nothing. It takes about 10 minutes for a treatment to occur. They'll often see a nurse or a doctor on any given day just for a quick checkup, make sure everything's going okay, and then they'll go about their way. So they're in and out of the door probably in 20 to 30 minutes. They feel nothing. There's no nausea, no vomiting, no hair loss, and it's really a very nice, patient-centered facility.
Excellent. A couple of upcoming community events and events for the public that I'd like to share with that ProCure is involved. They're continuing their Welcome Wednesdays series where the members of the community, if you'd like some more information about ProCure, you can visit every Wednesday from 12:30 to 1:30. There'll be some sessions that are going on. You can register at the website or, of course, walk in. But also coming up, a very special open house and a tour that's coming up on Friday, November 3rd, beginning at 11 a.m. Now, it's an open house and cyclotron tour, Dr. Soffen. What is a cyclotron tour all about?
Right. Well, periodically we open up the facility for the public because this is really sort of space-age technology that we enjoy showing off, and I think people find extremely interesting. A cyclotron is a very large generator of positive protons. It's probably almost as big as a Boeing 747, but it's a round circular area. It weighs hundreds of tons. And what it does is it generates from hydrogen gas, which is sparked, little minute protons, positively charged particles, that then get accelerated to about 2/3 of the speed of light. So we create extremely energetic protons in this large circular cyclotron, which then get sent down a beam line and focused to within a fraction of a millimeter within a tumor. So it is absolutely incredible space-age technology, and we love to have people take a look at this because there are only 20 cyclotrons in the country. So it is a commodity. It's rare to see, and it's very rare to be invited in to actually see this technology that is really cancer curing.
That's very cool. And again, that's going to be on Friday, November the 3rd. At ProCure in Somerset from 11 to 1. Lunch will be provided. You are requested to RSVP by visiting the website or by calling 888-481-6496. And check out the open house and cyclotron tour that is coming to ProCure. And again, just to kind of stress the importance of early detection and some available treatment options that are out there, Dr. Soffen. We lost recently a very well-respected and very well-known journalist, a television news anchor, known very well in this area by the name of Michelle Marsh, who in her early 60s lost a battle with breast cancer. So all the more urgent need to remind people that the fight is not over, Dr. Soffen, and with good people like ProCure on our side, we can win this battle, but it's far from over, obviously.
That's right, far from over, but there is every reason to be optimistic. If you do get this diagnosis, there are so many ways that have been improving, both with targeted therapies, with chemotherapy. Radiation is now safer, it's quicker, and very, very effective. So, yes, the fight isn't over. We need to detect these early. Women have to be diligent about screening and breast awareness, but every reason to be optimistic in the end.
All right, Dr. Edward Soffen from ProCure, thank you for your time this morning, and the fight goes on with Breast Cancer Awareness Month here in October. Thank you, as always, for your time, Dr. Soffen. All right?
Thank you, Bert.
All right, thank you. All right, Jersey Central traffic and weather time. It's already